Computerized tomography and magnetic resonance are two common imaging techniques used in brain imaging. They are both routinely used in neurology clinics for diagnosis and treatment planning, and are capable of mapping brain structures in a non-invasive manner. Compared to MR scans, CT scans are usually cheaper and faster to obtain. In many small clinics, magnetic resonance is not accessible. However, MR scans usually have much higher quality in terms of clarity and soft tissue contrast. This made identifying of different soft tissues in MR scans easier, and consequently, many techniques have been developed to automatically segment MR scans, but in comparison, very few has been done on CT images. To fill the gap in this field, in my final year project, we propose a segmentation pipeline that leverages generative adversarial networks to segment tissues such as gray matter, white matter, cerebrospinal fluid from CT scans. Generative adversarial networks are a type of neural network that is usually used for generation tasks. A generative adversarial net is composed of two subnetworks, namely a generator G and a discriminator D. During training, the generator and the discriminator play a two-player minimax game, where they share a common loss function that represents error rate of the discriminator. The generator tries its best to fool the discriminator, that is, to generate data that looks real enough so that the discriminator will mistake it as real data. The discriminator tries to tell what is real and what is fake as accurate as possible. In other words, the generator tries to maximize the loss function, discriminator tries to minimize it. Our objective is to identify soft tissues from a CT brain scan slice. Before I present our pipeline, I would like to discuss what can improve the segmentation quality. In the previous page, we discussed MR contains richer information than CT. Hence, if there's a way to translate CT scans into MR scans, it is reasonable to assume that if we can get information in the MR domain from the CT scan, we may be able to get a better segmentation result. With this idea, we propose a two-phase segmentation pipeline. In phase 1, we train a generator that is able to translate a CT scan into a synthetic MR scan. During this process, as can be seen from the figure, it will recover many information of the soft tissue structure. During the second phase, we consider this intermediate synthetic MR scan as input and train another generator to segment it. Since there are more visual information in the synthetic MR scan, it is easier for the second generator to segment this image, hence improve the accuracy of segmentation. We evaluate our pipeline using two commonly used segmentation metrics, namely intersection over union and death coefficient. As shown in this table, our method outperformed other segmentation pipelines such as UNet and Pix2Pix, demonstrating the effectiveness of our pipeline. We hope that you have gained a better understanding of our pipeline and brain image segmentation through this sharing. In this project, we have discovered an unexplored area in the field of deep learning-based CT brain scan segmentation. The capability of efficiently segmenting tissues from CT scans also brings many exciting business opportunities. With the possibility of directly recognizing different tissue parts from CT scans, many patients will no longer need to go through the tedious and expensive MR process. The team will keep working in this field to extend the pipeline to other problem domains. Thank you for listening.